Welcome, Penelope, and thank you very much for being with us.
Thank you for having me.
Right. As an obstetrician gynecologist, the world is open to you, with women needing your services. What led your decision not to pursue public health medicine qualification?
So it's a bit unusual what I've done to do more than one specialty in training. But I think when I went through both medical school and through my training in obstetrics and gynecology, it became very clear to me the inequity of access to healthcare that there was for women and the difficulty that women had in navigating health services, especially if they came from vulnerable backgrounds or culturally and linguistically diverse backgrounds. It became very clear that access to care was related to things such as the social determinants of health, those cultural and language barriers, health literacy, and also the clinicians' lack of understanding of those difficulties that women were having. And so I began to see that even though individual clinical influence is extremely important, and I support and appreciate all the amazing clinicians that are working out there one-on-one, I wanted to influence healthcare more from a policy and health promotion level. So I needed to understand population health medicine better to do that. Hence, I completed a master's in public health, and I've also completed my public health physician's training. So I'm a public health physician as well now.
Very impressive. You conducted a study which seems relevant to our work in overseas aid. The study was of Sudanese women here seeking health services. What did you find that was needed for them to access reproductive health services?
I'll start off by saying it was an amazing privilege to work with the women that I did, who were both migrant and refugee women from Sudan, who some of who'd lived in Australia for many years, some who'd been here for a short period of time. And it really, in speaking with them, it really did show me, again, some of the ideas that I had begun to understand about access to healthcare, and that having access to healthcare and gaining access to healthcare are very different ideas. And that really the people that really need the healthcare, the ability to gain healthcare the most, are the ones that don't have the access to it. So the things that we found were along these lines, that there's a problem with the structure of our healthcare system as it is. It doesn't account for people from vulnerable backgrounds, and that we really need to improve our health system and have it not on a horizontal equity scale, but on vertical equity, so we really can offer the same healthcare to every single person, regardless of what their background is.
Right. We need to take that on board. I understand you're working towards a PhD, not content with the qualifications you've got. What do you gain and what drives you?
It's a difficult question, I think, to answer, but I think I really do enjoy learning. And I've been lucky to have been exposed to opportunities where I can work and pursue education at the same time, and have been introduced to amazing educators and amazing inspirational people in the fields where I've been pursuing education. And because of that, they've given me the wish to be able to educate other people, improve communication, and to advocate for people to gain access to education as well. From the point of view of why I'm doing my PhD, I'm hoping to contribute back to those areas of education and communication. I'm going to be looking at the area of sexual and reproductive health literacy, and hopefully improve women's healthcare communication and education, both for clinicians and for women as well. So hopefully I'll be able to repay some of the benefits that I've had from having access to educational opportunities.
Wonderful, wonderful. What's your vision for health services in the future? How will this improve our ability to make contraception universally available?
This is a big question to answer in a short time.
Have a composure to go on.
I mean, we all know that access to contraception and education about contraception improves women's lives in every facet of their life, and improves not just their own life, but that of their family and their community as well. In order to have a health system that supports this. We really need to look at what the health system is doing now and try and change the things that it's doing badly. And really one of the things that we have to think about in our current health systems are that if we took Australia as an example, everything is done in silos. So there's lots of different services that look after women's care, from primary health care with GPs to hospitals and the different aspects of healthcare in hospitals, but they don't talk well to each other. And a lot of people don't even think to talk to people about women's health issues if it's not within their sphere. And equally, women often don't feel comfortable talking to some doctors about healthcare issues that are related to fertility or reproductive health, because I think that that type of doctor may not want to know about it. So what I would love is that instead of having women's health in certain areas, that there was a women's health plan that was overarching for primary, tertiary healthcare, rather than individual service plans, that we could have adequate supply of the people being able to give that healthcare, make it equitable, make it an enabling environment for women, and that we could meet and increase the demand for that service through health promotion and education. So I would love that to happen. And I'd love that in Australia we could make sure that we can meet our needs here, but we can also contribute internationally, so we can meet the goals that we've got internationally with the Sustainable Development Goals for everyone, with things like access to contraception.
Hear, hear. Your wider vision is wonderful. It's wise. We're looking forward to hearing you at the symposium. This is going to be very exciting. And thank you very much, Penelope, for giving your time tonight.
That's no trouble, Alice. And I look forward to being able to speak a little bit more about something that I'm very passionate about.
Great. Thank you.